A mass testing blitz is underway in Melbourne as the city attempts to get on top of coronavirus outbreaks in several suburbs. Reporter Steffi Ferrier joins us now from Melbourne. Steph, g'day. So what's happening there in Broadmeadows this morning?
Yes, good morning, Joe. Well, I'm here in Broadmeadows in Melbourne's north, where you can see behind me healthcare workers are taking their fight against coronavirus to the streets. They've set up on the street corner and they're conducting tests. These tests of people within the community. As you can see, there's a man who just lives a couple of doors down, and he is right now in the process of getting a swab taken to help out with this big effort, this unprecedented testing blitz that they are doing here, with a literal army of healthcare workers knocking on doors here and trying to find any hidden cases of coronavirus out here in the community. They're hoping to test half of all households out here in Broadmeadows, as well as 9 other suburbs. They are Keilor Downs and then Maidstone, Alban Vale, Sunshine West, Brunswick West, Fawkner, Reservoir and Hallam and Pakenham in Melbourne's southeastern suburbs. Now, they are hoping to test some 100,000 people here, and so they're certainly hoping that people who live out here really do heed this call. Now, this follows 33 new cases of coronavirus in Victoria, and that is the biggest daily increase that we've seen for several weeks. It's the 9th consecutive day of double-digit increases, and Premier Daniel Andrews has called this a public health bushfire. He's asking everybody to do their civic duty, come out and get tested. They're making it as easy as possible, as you can see with these paramedics behind me. And of course, if people do decide to come out and get tested, even if they've got no symptoms, they will have to isolate themselves until they get those results back. So for that end, the Victorian Government is enlisting the support of healthcare workers and laboratories across Queensland, New South Wales, Tasmania and South Australia, just to try to process those swabs as quickly as possible and really speed up that turnaround. Now, we're also, of course, getting the Army's help. We have heard that there's been a bit of a change in what the Victorian Government had asked for. Originally, it was talking about more than 1,000 troops coming over here and helping inside hotels. However, that has been amended so that those Army soldiers will be here to help with logistical support and healthcare support out here, as well as shuttling those swabs, flying those swabs to interstate and shuttling international travellers to those hotels.
And so, Steph, what's the schedule with those suburbs over the next 10 days? Are they kind of focusing on one suburb a day, or how's it working?
I think they're starting here in Broadmeadows and Keilor Downs, so they're the first 2 spots.
Yeah.
Keilor Downs, of course, was really classified as one of those massive coronavirus hotspots, and we've got a family cluster in Keilor Downs that really was quite large. So they're starting here, and then my understanding is that they are moving to those other 8 suburbs after that. And as I said, it's over 10 days, and they're hoping to get a really big turnout to unearth any sort of coronavirus that might be hidden in these communities.
And have people generally been keen to take part, and what's the community reaction and involvement been?
Well, by and large, most of the community reaction has been really positive, and you've seen people like this behind me. There's obviously people wanting to find out what's going on, and they're coming out of their houses. And so the reaction has been relatively positive. However, of course, there are always a few who just simply do not heed this message. And we saw some quite disturbing pictures yesterday of people who were hugging each other when they were greeting each other in the streets here in Broadmeadows, shaking hands, exercising absolutely no social distancing whatsoever, and other people who were asked about this and were saying that they really think that this virus is rubbish and it's just like any other virus, and they really don't have to worry about it that much at all, and they'll continue carrying on and going about the way that they normally interact with people close by and hugging them in any case. Now, this of course has caused a lot of concern with the Deputy Chief Health Officer here in Victoria, Annalise Van Diemen. Let's have a listen to what she had to say.
That kind of reaction is concerning to us. Our message has been really clear that people need to maintain their distances. People need to avoid hugging each other and they need to avoid shaking hands. They need to stay that 1.5 metres apart. I would thoroughly disagree that everybody has it and everybody is going to get it. We've had an extremely successful response in Victoria and across Australia to date.
And Steph, I haven't had the test done myself, but you see people getting it done, and I've spoken to some who say it's actually pretty full on with how far they shove the swab up your nose. Is that going to change a bit?
Yes, Joe, I have had it done as well. It does feel a little bit like an extreme shot of wasabi. It's not painful, but it is disconcerting, definitely. And I can tell you now, the Doherty Institute here in Melbourne has come up with a fantastic saliva test, which actually you put a sample into a cup and it doesn't require that really super long cotton bud that goes up your nostrils, up the back of your nose and down your throat as well. So Victorian Premier Daniel Andrews says it's certainly going to be a much more pleasant experience. Now, they are going to start rolling that out here in Victoria from Monday. Unfortunately, it's not going to completely replace the traditional swab test, and also it's not going to mean that you get your results or it can be processed any faster, because the laboratory processes are still going to remain the same. But of course, as you can see, there's door knocking that's going on here by health workers, which they'll be doing and they'll continue to do through the next 10 days in these 10 suburbs. We've also got other people coming up and getting themselves tested. So at the very least, there are people out there that are prepared to withstand this slight discomfort for the greater good.